Yeah, hi, my name is Gilberto de la Cruz, and I will be discussing the medical condition sickle cell anemia. There's two signs and symptoms of sickle cell anemia. The first one is definitely anemia, and without emia means blood conditioning. Sickle cells usually breaks apart easily and die, leaving patient without enough red blood cells. Red blood cells usually live for about 120 days before they need to be replaced, but the patient who has sickle cells anemia usually die in 10 to 20 days, leaving a shortage of red blood cells. It's called anemia. The second is acute pain. Acute pain is related to tissue hypoxia. Hypo means insufficient, oxo means oxygen, emia means blood condition, due to agglutination or clump together of sickle cells within blood vessels, causing a lot of pain. There's two diagnostic testing. The first one is the hemoglobin electrophoresis. It's a blood draw, a blood sample that's taken from the vein in patient's arm. Hemoglobin electrophoresis is a test. It's a blood test used to measure and identify the different types of hemoglobin in your bloodstream. Hemoglobin, hemo means blood, globin means protein, is the protein inside red blood cells responsible for transporting oxygen to your tissue and organs. If an abnormal hemoglobin S is present, patient can be diagnosed for sickle cell. The second one is the amniocentesis for prenatal diagnosis. Doctors can diagnose before a baby is born. This is done using a sample of amniotic fluid, the liquid in the sac surrounding a growing embryo. Medical staff will be inserting a needle through patient's belly and into the womb, withdrawing a small amount of amniotic fluid. Testing before birth can be done as early as 8 to 10 weeks into pregnancy. This testing looks for sickle hemoglobin gene rather than abnormal hemoglobin. There's two treatments for sickle cell anemia. The first one is the bone marrow transplant. Bone marrow transplant, also known as stem cell transplant. It offers only potential cure for sickle anemia. Stem cells can be found in bone marrow. Bone marrow is the substance in the center of your bone that produces red blood cells. A person with sickle cell disease has bone marrow that produces red blood cells with defective hemoglobin S. But if the bone marrow is replaced with healthy bone marrow, a person's body may start to produce normal hemoglobin. Stem cell transplants require bone marrow from another person or a donor. The second one is just a medication. It's hydroxyurea. It can be taken by mouth, via tablet or capsules. When taken daily, hydroxyurea reduces the frequency of painful crises and might reduce the need for blood transfusion and hospitalizations. Hydroxyurea seems to work for stimulating production of fetal hemoglobin or hemoglobin F, a type of hemoglobin found in the newborns that helps prevent the formation of sickle cells. My references are WebMD, titled Hemoglobin Electrophoresis. It was written in 2015. Also, the Mayo Clinic, titled Sickle Cell Anemia, written in 2016. I also looked for Healthline.com for titled How is Amniocentesis Performed? It's written in 2016. And also, I look at another one on WebMD titled Stem Cells Transplant for Sickle Cell Disease, written in 2015. Also, I used one of my favorite book. This is the nursing medical surgical textbook. It's 11th edition. And that will be it. Thank you.